Many primary care clinicians work harder every day, yet their income barely changes. And the reason might not be what you think. Hi, for the ones who don't know me, I'm Dr. Jerina Gani, a primary care doctor based in Boston with 20 years of experience. I'm passionate about primary care, and my desire is for all primary care clinicians to find joy in their work and be satisfied financially and emotionally. Now let's go back to our topic. You see, most of us believe we are underpaid because the healthcare system is broken. And while there is some truth to that, there is another reason we don't talk about. And surprisingly, it often has nothing to do with how hard we work. When I started practicing primary care, I believed the way to increase income was simple: just see more patients. So I pushed myself to see more and more, 22 patients a day and sometimes even more. But something strange happened. The harder I worked, the more exhausted I became, and yet my income did not increase nearly as much as I expected. That's when I started looking more closely to how primary care practice actually functions. And I realized something important. Many primary care clinicians are doing extremely complex medical work, but the structure of the practice does not capture the value of that work they do. In primary care, we often manage many things: multiple chronic conditions, preventive care discussions, medication adjustments, complex medical decision-making. But when visits are rushed or documentation is incomplete, the value of that work is not fully reflected. So clinicians end up doing the work without capturing the value of that work. What surprised me the most was the increasing patient volume often doesn't help and solve the problem you have. Seeing more patients can actually make it worse, in fact. Because when visits become shorter and more rushed, documentation becomes harder, and important aspects of care may not be captured properly. The issue often is not effort, it's structure. How visits are organized, how schedules are designed, how documentation reflects the complexity of care you do. Once I began focusing on that aspect of my practice, something interesting happened. I was able to reduce the number of patients I saw each day, while actually improving both patient care and my income. And perhaps, most importantly, my work became sustainable again. All of us as primary care clinicians play an incredibly important role in healthcare. We coordinate care, detect problems early, and guide patients through complex medical decisions. But the system should not require us to sacrifice our own well-being to do that work. The solution is not working harder, it's redesigning the system in which we work every day. When the structure of the practice improves, both patient care and clinicians' well-being often improves together. If you're interested in learning more about the framework I use to optimize my practice, you can find more information in the link below. Hi, this is Dr. Gani again, wishing you a great work-life balance.